If you use a CPAP machine for sleep apnea, a leaky CPAP mask can seriously affect your therapy. If air is escaping from your mask, you may not receive the proper air pressure needed to keep your airways open and treat your condition. A leak can also cause your airways to dry out, irritate eyes, and disrupt sleep. You might notice one or more of the following if there is a leak while using your CPAP machine: a hissing or whistling sound, air blowing into your eyes, dry mouth in the morning, red pressure marks on your face, high leak readings on your CPAP display or app. If you're seeing these signs, it's time to troubleshoot. There are two main types of leaks: a seal leak and a mouth leak. A seal leak is the most common kind of leak, caused by an ill-fitting mask when there's a small space between your face and the seal. A mouth leak happens when you breathe with your mouth open and air coming from the mask escapes from your throat out of your mouth. Both of these leaks can cause the same problems. If the pressure that holds your airways open isn't being maintained, that will affect your health and impair the machine's sensors and can cause inaccurate event detection. Ultimately, a leak will cause your CPAP machine to wear down faster, and it can also blow air on your face and in your eyes, which is both annoying and drying. So taking steps to fix or prevent these leaks is imperative. If you have a seal leak, it might be because of a crease in the seal. Turn off the machine, pull the mask away from your face to smooth out any creases in the cushion, and gently rest it back against your face. Over-tightened masks can also cause air leaks. Wear it loose and tighten just enough to hold it in place. Not every mask works for every patient. Try a couple of different masks before purchasing and consider a high-quality mask that won't bend in the seal. Replace worn cushions regularly, as silicone softens and loses shape over time. Now let's look at fixing a mouth leak. Consider switching to a full-faced mask if you breathe from your mouth. Another solution is using a special nasal pillow called a CPAP pillow, which is shaped to prevent leaks. If leaks continue despite adjustments, it may be time to replace your mask components. Regular replacement helps ensure proper therapy and better sleep quality. Take a look at our other videos for more information about CPAP masks and machines. And if you have any questions, please reach out. Our oxygen experts are ready to help. When you breathe easier, we breathe easier.